Hello and welcome. Today we're diving into the world of Charcot-Marie-Tooth disease, often abbreviated as CMT. It's a mouthful, but understanding this inherited neurological disorder can make a real difference for those affected and their families. We'll explore what CMT is, what causes it, how it's diagnosed, and what can be done to manage it. So, what causes CMT? The short answer is genetics. CMT is almost always inherited, meaning it's passed down through families. It's caused by mutations in genes that affect the nerves in your arms and legs. These genes are responsible for producing proteins that help form the myelin sheath, which insulates and protects nerve fibers, or the nerve axons themselves, which transmit electrical signals. Think of it like a faulty electrical cord. If the insulation is damaged, the electrical signal can't travel properly. Now, let's delve into the pathophysiology, or how CMT actually affects the body. The genetic mutations lead to damage of the peripheral nerves, the nerves outside the brain and spinal cord. This damage can take two main forms: demyelination, where the myelin sheath is damaged or destroyed, slowing down nerve signals, or axonal degeneration, where the nerve fibers themselves are damaged or die. Both types of damage disrupt the transmission of nerve impulses, causing a variety of symptoms. CMT is the most common inherited neurological disorder, affecting approximately 1 in 500 people worldwide. It affects people of all races and ethnic groups. Because it's genetic, the prevalence remains relatively consistent across different populations. While it can manifest at any age, symptoms often begin in adolescence or early adulthood. Sometimes symptoms are so mild people are not even aware that they have it. The signs and symptoms of CMT can vary quite a bit from person to person, even within the same family. Common symptoms include weakness in the feet and legs, leading to difficulty walking and frequent tripping. Foot deformities like high arches or hammertoes are also very common. As the disease progresses, weakness can spread to the hands and arms, causing difficulty with fine motor skills like buttoning shirts or writing. Sensory loss, such as numbness or tingling in the toes and fingers, is another frequent complaint. Some individuals might also experience muscle cramping or pain. Diagnosing CMT typically involves a combination of a thorough neurological examination, a detailed family history, and various diagnostic tests. Nerve conduction studies are used to measure how quickly electrical signals travel through the nerves. Electromyography, or EMG, assesses the electrical activity of muscles. Genetic testing can identify the specific gene mutation causing the disease. A nerve biopsy, where a small sample of nerve tissue is examined under a microscope, can also be helpful in some cases. CMT isn't just one single disease, it's a group of related disorders. There are many different types of CMT, each caused by a different gene mutation. The main classifications are based on how the nerves are affected. CMT1 is typically caused by demyelination, while CMT2 is caused by axonal degeneration. There are also intermediate forms that involve both demyelination and axonal degeneration. Identifying the specific type of CMT is important for understanding the expected course of the disease and for genetic counseling. Unfortunately, there's currently no cure for CMT. However, there are many things that can be done to manage the symptoms and improve quality of life. Physical therapy and occupational therapy are crucial for maintaining strength, flexibility, and range of motion. Orthotics, such as ankle-foot orthoses, can help support the feet and ankles and improve gait. Pain management strategies, including medications and alternative therapies, can help alleviate discomfort. In some cases, surgery may be needed to correct foot deformities or relieve nerve compression. Since CMT is a genetic disorder, there's no way to prevent it from occurring in the first place. However, genetic counseling is available for individuals with a family history of CMT who are considering having children. Genetic testing can help determine if they are carriers of the disease and assess the risk of passing it on to their offspring. This information can help families make informed decisions about their reproductive options. The prognosis for people with CMT varies depending on the type of CMT and the severity of symptoms. CMT is a slowly progressive disease, meaning that symptoms typically worsen gradually over time. While it can significantly impact quality of life, it's generally not life-threatening. Recent research has focused on developing gene therapies that could potentially correct the underlying genetic defects causing CMT. Clinical trials are underway to evaluate the safety and efficacy of these new therapies, offering hope for more effective treatments in the future. Researchers are also investigating potential drug targets that could slow or halt the progression of the disease.